Hello everybody, and welcome to my first case study of the semester in section 108. My name is Tyler Segura, and today we will be going over reinforcement and punishment. We will be going over schedules of reinforcement, generalization and maintenance, as well as finding the MO, motivating operation, while looking at a case that I have gone through. Looking at this case, it is an intervention that we implemented with a client who had been engaging in escape maintained off-task behavior. He previously came from a school environment, and we were able to provide intensive services to decrease this problem off-task behavior while teaching appropriate self-management skills. A little bit about the client. He was a 9-year-old boy who was in 3rd grade. He had a ASD diagnosis, and he came from a general education classroom before receiving services at our ABA clinic. When he came in, he did not just have the escape maintained behavior, there were also many other behaviors, but for the sake of this case and PowerPoint, we are going to focus on the off-task behaviors. So ultimately, we could have decided to either reinforce on-task behaviors or punish off-task behaviors. So I'll give an example of positive and negative, both reinforcement and punishment for this example. If we decided to positively reinforce on-task behaviors, we could have given him verbal praise, attention, or tangibles or access to an activity for engaging in on-task behavior. We also could have removed any worksheets by giving him a break and giving him that escape by negatively reinforcing that effect of asking for a break. We even could have included it into the schedule to let him work for a certain amount of time knowing that a break is coming up. We also could have punished that off-task behavior by positively punishing it by giving him extra worksheets if he decided to engage in off-task behavior. And then we could have negatively punished by removing those preferred tangibles or not allowing access to those preferred tangibles or activities if he did engage in off-task behavior. Some assessments that we used to determine where the client was and also what an effective intervention would be was, well, initially we used the BB map to determine the client's skill set as well as the barriers that they had barriers to learning. When the parents came in for the initial assessment, we sat down with them and we were able to ask them questions about how their child, our client, is able to interact in all sorts of different environments and also learn more about those problem behaviors, especially the off-task behavior that we're talking about today. We also were able to sit down and do direct observation, both during the initial assessment and then also as we began treatment. We were able to observe the client frequently throughout his time, his first couple weeks here. We were able to see some behaviors that we needed to complete an FBA on, our functional behavior assessment, to determine what the function of these behaviors are, specifically looking at the off-task behavior. After completing the FBA, we were able to determine that escape was the maintaining function of the off-task behavior. After finding the function, we were able to come up with a function-based intervention, which you see right here. The first step was to lay out the contingency by using a pre-med principle or a first-then statement. To lay out the contingency, first we are going to work on an academic task, was the most common task we would do for this intervention, and then you are going to be able to access reinforcement. And we'll get into how we determined reinforcement in the next slide. After we laid out that contingency using the pre-med principle, we taught functional communication training to allow the client to ask for a break once they had reached the point where they were about to engage in off-task behavior. After that, we began to fade out our verbal prompts with visual reminders, visual cues that were on his desk that would remind him that he could ask for a break whenever he needed one. And then we were able to differentially reinforce. So in the beginning, that looked like differentially reinforcing if the client completed the task without engaging in off-task behaviors, other than, of course, functionally communicating for the off-task behaviors. Eventually, we differentially reinforced asking for off-task behaviors by using a DR To determine the motivating operation and the reinforcers for this client, we were able to run preference assessments weekly and sometimes even more often if need be to ensure that the reinforcers remained effective. We also were cognizant of the environment and paid attention to establishing or abolishing operations that might be of effect, such as food might be less reinforcing right after lunch, or going outside to play. We still have a playground at the clinic that we were at that point. We have a playground outside that might be less reinforcing, an abolishing operation if it was raining. We also were able to do a VI assessment in the beginning of variable interval assessments to determine how long the client could sit and work for before engaging in that off-task behavior. And once we did that, we were able to determine the appropriate amount of length to start at before increasing the criteria, but the appropriate length to start at as we began this intervention. Some ways that we ensured maintenance and also generalized this skill was, well, we ran this intervention multiple times a day to ensure maintenance. We also taught generalization by teaching this skill across multiple environments and across multiple types of tasks, not just academic tasks, but also social skills and several other tasks that we may engage in a typical school day. We were able to teach him how to ask for breaks in all sorts of environments. There were a few instances in which we modified the intervention. One instance was when we decided to contrive the environment to ensure that generalization was taking place by communicating the classroom environment or classroom setting as best as possible. This meant both having peers in the room as well as contriving the environment to fit with a desk with more demands being placed and, of course, more peers in the room as well. We also were able to implement parent trainings, and so this parent for this case was very invested in learning how to best treat and care for their child, and so once a week they came in for an entire day, 7.5 hours, and they were able to at first just shadow the RBT as they implemented this intervention, but by day two they were the ones that were implementing the intervention in the clinic so that we could give them feedback and they were able to increase the fidelity of the student at home and also be able to do the same at school. Some takeaways and the outcome of this case was, well, the outcome of the case was it was a successful intervention. We did have to make some modifications along the way, but this intervention was able to reach maintenance and stay in maintenance as he transitioned out of the clinic, and also we were able to generalize this skill to be used in the school as well as at home or any other environment. Some takeaways that I got from this was the importance of using a visual schedule, especially when we are increasing the length of a VI or VI, the length that the learner is working for. Using a visual schedule really helps to avoid over-prompting the client. This was my first experience working with an older kid who does demonstrate these off-task behaviors that don't also include more dangerous behaviors such as tantrums or aggression or even elopement. And so this was able to give me a more in-depth look at how to really use a criterion-based strategy to be able to decrease these off-tasks.